It's becoming more and more popular as people are seeing the benefits of naturopathic medicine. Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine to tell us more about it. There's an actual week designated to it.
Yeah, recently the U.S. Senate created or passed unanimously this resolution to make this week National Naturopathic Medicine Week. And they're wanting to recognize naturopathic medicine because of the value it provides for safe, effective, affordable health care. You know, we're all talking about health care and this debate, what is the best way? Really, we have a sick care system. Naturopathic medicine is all about health care. And we really have a care system that only treats disease, waits till the end of disease, and then uses heroic measures like heart disease. We have, the U.S. Senate in this resolution stated that 75% of all the healthcare costs today is due to chronic, preventable diseases like heart disease and diabetes, cancer even, strokes. Those are all preventable, and naturopathic physicians really know how to do that. But conventional medicine is so caught up in the crisis intervention at the end of the disease.
Well, that's why naturopathic medicine is so special, because they get to it before this stuff. It's preventive. It's
preventive. And so I've been a physician for 27 years here in the Phoenix area. And we recently just moved into a new office. I want to show everybody where our new office is.
Very nice.
And you know, this is modern medicine, but we go back to our roots for the philosophy. Really, naturopathic medicine is all about prevention. And in 27 years, what I love about medicine is actually preventing these diseases. And the first thing that makes us different is, primary philosophy is do no harm. That's the first thing we look at. In conventional medicine, you know, all the drugs that we have, 2.2 million adverse drug reactions every year, 100,000 people die from known side effects to these drugs. When I first started practice, it was just if one drug caused one death, it was taken off the market. So nowadays, it's thousands of deaths before it's ever considered taken off the market. And usually they just give a warning then, because they justify it somehow by the millions of people that are getting prescriptions. But so first, do no harm. That's what naturopathic medicine is all about.
And why doesn't conventional medicine pick up on this?
Well, they don't, because they're just so ingrained in treating, you know, crises, and they don't get to the prevention. Naturopathic medicine does. The first is do no harm. The second is really treating the whole person. We look at the whole person. Cardiologists, for example, don't realize the connection between reducing cholesterol, and then that affects a lot of other hormones downstream. We need cholesterol to make testosterone, progesterone, all the estrogens that we always talk about. And when they suppress cholesterol, then you push all those down and create more imbalance.
And you have an example of a patient. You know, this kind of tells the story about what you do and how you can help folks. We're looking at her picture now.
Well, this is Lorna, a great story. She came to me recently with a list of symptoms that, you know, no energy, weight gain, no sex drive, low blood sugar, cold. She was always cold, heart palpitations.
I see the fatigue. A lot of women, especially at that age group, just always feel tired.
Oh, yeah. She, you know, typical menopause. She hadn't slept in 27 years. She had no sex drive. She was fatigued, of course, all the time because she hasn't slept. She's a school teacher, and she works 60 hours a week. She doesn't have time to exercise, so she gains weight. We test her hormones, and we see they're all out of balance, and they're all very, very low, as you can see from this test result.
This seems to be very common with all the patients that come in to see you. Their
Everybody
hormones are
should
all
get these hormones tested. This is more important than a mammogram. Mammograms find cancer late in the stages of progression. With these hormone tests, we can actually see the cause, which is too much estradiol, too much estrone, and not enough estriol or progesterone. Estriol and progesterone actually prevent cancer. They reduce the cancer markers. Progesterone activates tumor suppressor protein, a positive anti-cancer agent our bodies make, we just don't have enough of. So we give these to her, and you saw on that last slide, that once we do, all of her levels come back up. Within 3 months, she's sleeping for the first time in 27 years all the night through. She feels great. She's got more energy than she's ever had before. I ask her, so you look like you're just feeling awesome. She says,
and that's
I am feeling better than I have ever felt before. No hot flashes, all the menopause symptoms, the muddled brain, all that's gone. She feels awesome.
Well, I'm sure people are watching who have felt that way, want to feel better, and you do have a very special offer this time.
Yeah, we're trying to offer two things, because heart disease is the #1 killer disease. 75% of all our diseases are preventable. The best way to prevent a heart attack is to learn your risk in your arteries. So we look at a carotid artery ultrasound.
Very nice.
Non-invasive, another key to naturopathic medicine, do no harm. So it's an ultrasound, non-invasive. We want to give one viewer a free ultrasound, and we'll give another viewer a free hormone test, preventing breast cancer, ovarian cancer, uterine cancer, know your hormones. You got to check out those hormones. Go to our website, sign up for the newsletter.
And you'll
You're
get valuable
automatically
information too. Very
registered,
important.
yeah, and learn about naturopathic medicine. The Synod is saying it really holds the answers to solving our sick healthcare system and reducing the cost by preventing those diseases.
Very true. Thank you so much, Dr.
Thank
Hansen.
you.
A lot of really, really good information. And if you want more about the Hansen Clinic of Natural Medicine, you can go to drhansen.com or call the number you see right there on your screen.